to bring in epidemiologist and ABC News medical contributor Dr. John Brownstein for more on this new mutation and the latest on the vaccine. Dr. Brownstein, dozens of countries are banning flights to and from the UK right now. In your medical opinion, should the US be doing the same?
Yeah, hi, Diane. I mean, the concern is, of course, that this new variant is rapidly replacing other variants. We've seen this rapid rise over the last 3 weeks, the steep increase in cases across parts of England, London, of course. We've seen like the explosion of cases. But the reality is this variant has been around for weeks, if not months. And England found it. They have great surveillance. They identified this variant, but it's probably that we've missed it in other parts of the globe as well. We've seen this throughout the entire pandemic where there are variants that emerge and our surveillance just hasn't been good enough. So if you think about a travel ban, that's a really severe implementation of an intervention. And we're not doing some of the basic things like testing, pre-boarding, testing when you arrive. We could be implementing forced quarantine when people get here. Those are basic public health strategies that we should have at a national scale. We're seeing New York implementing some of this, but it should be done at a national scale at this point, and we've really missed the mark.
And I notice you say variant. We've also heard strain and mutation. Is there a difference between these words, and which one are we dealing with here?
Yeah, this is complicated, and it's sometimes a bit nuanced in genomic epidemiology. We look at these trees to show sort of differences in genetic change across different viruses. And if the virus accumulates enough change, it sort of creates a new, what we call lineage. And that lineage can lead to new strains. In this case, it's likely a new strain. There's more work that's being done across my colleagues that do sort of genomic surveillance. And this is where it gets a little bit nuanced, but I think we can start to call it a strain, but we want to be careful not to think that this is one that will essentially be the dominant version of what we'll have in the US. So more surveillance is really needed to fully sort of uncover what is going on. And clearly our surveillance data just hasn't been as good as it could be at this point.
So is variant kind of a more mild term than the word strain?
Exactly. So variant is sort of the broad sort of term that, explains how these viruses are changing over time. They have these changes in amino acids. This particular variant has about 17 changes, which is a lot. And this is why likely we're starting to call it its own strain.
Okay, got it. And mutation sort of covers it all. That's exactly one that we know that we're safe with. So we've heard that this variant isn't any more deadly, but that it is more transmittable than the original. So do we have to take any extra steps to protect ourselves from this version of it?
Right. The reason why we're concerned, of course, is some of these changes that happened are actually related to the spike protein, which we know lead to the virus infecting cells. And this is why we think it's more transmissible. But it's important to know that we're still trying to uncover the data of how much more, and we're not quite sure. But the evidence currently says that the virus is not more lethal. It doesn't cause more sort of severe illness. So it doesn't really change much in terms of our strategy. We have so much virus circulating in the country already that it's basic public health. The things you and I have been speaking about for months now, hand washing, social distancing, mask wearing, that's the same interventions regardless of whichever variant we're talking about.
And scientists say that the vaccines that have already been created, that are already out there, they should cover this. How can they be sure of that?
Yeah, it's a great question. Of course, as scientists, we're going to be concerned about this. But the view is that it takes, months, years for the virus to accumulate enough mutations for it to sort of escape the vaccine. Right now, this vaccine has about 1,200 amino acids. Only about 9 of them have really changed, according to this new variant. That's not a lot. And our body can mount a response that essentially covers these changes in the virus. The bigger issue that we think is what we call antigenic drift. I know that's a complicated term, but what it means is the virus eventually evolving to the point where the vaccine doesn't work. This is what happens with the flu vaccine, where we have to change it every year. So the longer term concern is, will we have to think about future COVID vaccines that need to evolve as this virus evolves? That's a big question, but I don't think it really impacts anything in the short term over the coming months as we try to get this sort of mass immunization underway.
All right. Well, that sounds like good news, at least. And I want to hit you with some viewer questions, if I can, that I got on Twitter. One person wants to know, now that both vaccines are in circulation, who determines which one you get?
Right. It's a great question. A lot of people wondering if they'll even have choice. The reality is people will not have choice, right? When it's your turn in line, you'll just want to get that vaccine, whichever one is available to you. The good news is between Pfizer and Moderna, they're so similar, right? They're both mRNA vaccines. They both have about 94% efficacy, very similar safety profiles, very minimal risk. So the reality is, and also this vaccine is sort of works across gender and race. So, the reality is you will get the vaccine that is available to you, and they're both incredible vaccine, incredible options to have.
And then how do you know when it's your turn to get vaccinated, if your underlying condition qualifies as an underlying condition? And then how do you prove that you fall into that group?
This is a big question, and frankly, I actually don't think that all states have quite figured this out. We know that the CDC has made these recommendations around certain vulnerable populations getting the first, those 1B and 1C vaccines. It's going to be challenging. The states are going to have to put out big, campaigns, media, social media to explain to people who is eligible at what point. The CDC is putting out some tools to explain that. And then it'll be sort of attestation forms. People are going to have to verify that they have these conditions. They'll probably have to work with their providers to provide them with information and sort of documentation of conditions. But it's going to be very complicated. And I think it's going to be tough for people to fully understand this. So huge amount of communication is really going to be needed to explain sort of your part in the line for this vaccine over the coming months.
But then something else I got to ask, will you need a prescription for it if you have to work with your provider, or is this still something you're just going to be able to go to the pharmacy and get directly?
You're going to still be able to just go to the pharmacy and get this vaccine. You may have to provide some of your insurance information, but the vaccine is going to be free for everyone. That's been made very clear. You will not need a prescription. You'll need to verify some basic information about yourself, but the vaccine will be made available to everyone.
All right, Dr. John Brownstein, thank you as always for answering all our questions.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.